the sleep community is at the moment advocating that we go to permanent standard time. First of all, we need to eliminate the changes twice a year. They only lead to problems with our sleep. The spring forward is particularly problematic because we all lose an hour of sleep and we think, oh, an hour of sleep, that's not that bad. But it actually can cause a lot of problems. There's clear evidence of increased motor vehicle accidents, heart events, mood disturbances in the days following the change of time. So we definitely need to eliminate the twice a year time changes. The American Academy of Sleep Medicine, as well as other sleep organizations, feel strongly that we need to move to permanent standard time. There's a lot of arguments for it, but probably the biggest one is that when we're on daylight savings time, we actually are probably reducing our sleep in a chronic fashion. We think that it's just happening at the beginning of the time change, but there is evidence that we get less sleep throughout daylight savings time, because having more sunshine in the evening means we go to bed later, and not having sunshine in the morning can sometimes mean that we also don't go to bed earlier. So we strongly feel that it needs to be permanent standard time. If we went on permanent standard time, it would mean that in certain parts of the United States, sunrise is pretty early in the summertime. And we would argue that that's okay because we need to get our days going. And it's okay to have sunshine in the morning. Sunshine in the morning actually helps us fall asleep at nighttime. And having a little less sunshine in the evening also helps us fall asleep better. So we don't think that it's much of a problem. What we really think is the problem is permanent savings time in the wintertime. There would be parts of the United States that sunshine does not happen to 9 or 9:30 in the morning. Kids would be walking to school in the dark on a regular basis throughout the winter. And as I like to point out, we tried this in the United States once before, in 1973, 1974. I actually remember walking to school in the dark in New York City. I was in elementary school at the time. People hated it, and Congress abolished it before the end of the 2-year experiment. So we tried this. There are 2 states in our union that are on permanent standard time, Arizona and Hawaii. They do fantastic. They don't suffer. Their people do very well with their sleep. So that's why we feel strongly about standard time. I would say we are at the mercy of lawmakers. The Academy is advocating to get someone to put forward legislation at the national level so that we can get permanent standard time. In the meantime, we keep fighting. Most of the legislation keeps wanting permanent daylight, and we're like, no, you can't do that. The other thing the Academy is doing is also working at the state level. Because while nationally, this does need to be done nationally, in theory, each state can be on permanent standard time if they wanted to be, just like Arizona and Hawaii. So we're working at the state level, again, mostly to prevent permanent daylight savings time, but also try to advocate for a permanent standard time. Generally, what most of us feel is just that hour of sleep deprivation. So we feel groggy, we feel sleepy, we feel tired. We may not think correctly. You'll want to take an afternoon nap on Sunday, which is probably may or may not be a great idea if you want to try to sync yourself to the clock again. That usually then gets into the work week and to the school week. So people may not feel productive the first several days of the work week as well. So definitely a problem that extends several days. We do have a few tips for people. The most important one is you should be getting 7 hours of sleep a night going into the weekend. You should be getting 7 hours of sleep a night anyway, but definitely this week would be a good week to be shooting for the recommended 7 hours of sleep at night. Another thing you could do is you could gradually shift yourself for the few nights beforehand. So if you start going to bed about 15 minutes earlier each night for 3 or 4 nights before Saturday, it It would mean on Sunday, you've already shifted the hour and would be able to go to sleep at a reasonable time. We also recommend that you head outdoors first thing Sunday morning. Again, sunshine in the morning helps set your body clock. So going out first thing Sunday morning and then continuing that during the week could help you feel better as well. Finally, if you are not totally dependent on your cell phone for timing, for a clock, it's actually recommended that you reset your clock before you go to bed and then go to bed at your quote normal bedtime. And that allows you to sleep, get a little bit more sleep that night. Problem is that so many of us use our cell phones now and they can't be adjusted. They adjust themselves at 2 o'clock. But if you aren't dependent on your cell phone, that might be one thing to do as well. Yeah, probably the group that's probably most impacted is adolescents, and they're another argument against permanent daylight time. Many adolescents already have social jet lag. They get less sleep on the weekdays, more sleep on the weekends, and this would be exacerbated. This is exacerbated a little bit this weekend because again, they're going to get that less hour of sleep that they maybe need because they're not getting enough during the week. But again, there's also evidence that social jet lag would worsen with permanent daylight time. One of the things that's another big movement in the country is later start time, school start times for high schoolers, and that would all be negated if we went into permanent daylight time. Adolescents will probably hit more than any in the sort of children group. Adolescents would be the ones hit the most. From a health point of view, probably not. I'm not an expert on this, but you'd probably find people that say there's benefits for business and tourism and stuff like that. But as a physician and as a professional organization, we feel strongly that the health of our population is more important than those things with this particular issue. Sleep deprivation does lead to our immune systems not functioning as well as they should be. And there is thought that, again, permanent daylight time might lead to, some dysfunction of our immune system. But I'm not sure I could do a correct, direct relationship to new and unforeseen viruses and stuff like that. We just always, I already said it once, but I'll say it again. As a sleep community, we feel strongly that you should be getting 7 hours of sleep per night. As much as you can, because it really will lead to better health outcomes in so many different ways if you do so.